I've always been fascinated by the way our health depends on the health of the planet. Climate change is leading to an increased frequency and intensity of extreme climatic events like hurricanes, floods, and droughts. But we don't hear very much about how this will impact the distribution of diseases around the world.
Barcelona. It's well known as one of Europe's favourite tourist destinations. What's less well known is that mosquito populations that spread dengue fever, a disease found in the tropics, are increasing. Combined with international travel, this increases the risk of local dengue outbreaks. Rachel's here to understand the link between climate change and mosquito-borne disease and help prevent its spread in Europe.
The number of dengue cases reported to the World Health Organization has increased eightfold over the last 2 decades. In 2000, 500,000 cases were reported, and in 2019, over 5 million cases were reported.
More than half of the world's population lives in an area infested by mosquitoes that carry diseases like dengue and malaria. They thrive in warm and humid conditions and breed in water containers and discarded waste. Even the trade in used tires, which easily collect water, has been linked with the spread of dengue fever.
The Aedes albopictus mosquito, which is commonly known as the tiger mosquito, was first detected in Spain in 2004, and since then has been spreading throughout the Spanish territory and is found across much of the Mediterranean.
One of the reasons for the spread of these mosquitoes in Europe is our warming climate. Rachel is meeting with John Palmer, who co-directs a citizen science project called Mosquito Alert, to find out how concerned he is about this worrying trend.
I think your work really shows how worried we should be, that it's a big problem. We've seen the outbreaks that we have had here in Spain, in France, in Italy, and we should expect that those will increase, and we really need to be prepared for this.
Anyone can use the Mosquito Alert app to upload a photo of mosquitoes, as well as report mosquito bites and breeding sites. Reports are verified by experts and used to monitor and control mosquitoes in neighborhoods and cities.
More broadly, we simply need to deal with this problem worldwide because we know the burden it imposes, we know how much it exacerbates inequality, and it's a huge issue.
To get a worldwide view of the situation, Rachel collaborates with many scientists across the globe. She regularly speaks to Leslie Rollock from the Ministry of Health and Wellness in Barbados, where Rachel's team is using climate data to predict the risk of dengue outbreaks.
Climate factors impact dengue risk by increased likelihood of cases when it is hot and wet, after a high rainfall, for example. Essentially, to prevent and control dengue, we control the vector, the mosquito. So we remove the breeding sites, kill the adults using whatever measures we have, and warn householders that the dengue is increasing in the country.
Rachel's work needs a lot of computing power, so she's collaborating with Barcelona Supercomputing Center to process the data faster.
The research on climate change, and in particular the projections of anthropogenic climate change into the future, would be absolutely impossible without a supercomputer. The computer allows us to solve climate modeling problems in a month that without the computer will take us easily 100 years to solve them. The supercomputer will allow Rachel to have access to the latest artificial intelligence technology and to the best global databases on climate information.
In a model, we combine meteorological data with observations from satellites about the land use and land type, with socioeconomic information about the level of urbanization, access to piped water and other sanitation indicators. By predicting when and where epidemics might occur, we can direct interventions to the most at-risk areas in advance. I've been working with colleagues in Peru to try and understand the emergence of diseases like dengue in the Amazon rainforest.
Over there, they're using drones to monitor what's happening on the ground.
Drone can help to improve our models because we can get detailed data about those conditions. For example, landscape coverage and some determinants of these human behaviors. In these areas where we don't have piped water, for example, we can understand how is the distribution of the water containers. And in rural areas, we can detect the breeding sites of those mosquitoes close to the forest fringe.
Climate change combined with globalization, international travel and trade, unplanned urbanization, poor sanitation and poverty all create the perfect storm for explosive epidemics of diseases like dengue fever. There needs to be a drastic reduction in the harmful greenhouse gases which are released into the atmosphere in order to reduce the risk of these diseases spreading to new areas.
Rachel's work shows that climate change has the power to cause even more suffering in places already affected by mosquito-borne disease. But other parts of the world, such as Europe, may soon come under threat too. With the help of collaborators across the globe and the power of new technology, Rachel and other scientists can help stop outbreaks before they occur, and ultimately save lives.